Are you comparing Medicare versus your employer insurance? With so many people working past age 65 these days, many are in the same boat. But did you know it doesn't have to be just one or the other? If you are still working, there are several situations where Medicare and an employer health plan can work side by side. So in this video, I'll discuss which parts of Medicare you need to enroll in if you're still working and how the size of your employer affects that decision. Stick with me until the end of the video, and I'll also tell you the one circumstance in which people who are working should never enroll in any part of Medicare. If you are turning 65 and you or your spouse will continue to work and have employer-sponsored group health coverage, the employer's size determines whether you should enroll in just Part A or Part B or both. If the employer has more than 20 employees, then that employer coverage is primary and Medicare will be secondary. So in this scenario, most beneficiaries just enroll in Part A, which is Medicare's hospital coverage. Part A costs nothing if you have worked at least 40 quarters or 10 years in jobs where you paid Social Security taxes. And even if you didn't, you may be able to get Part A for a zero premium through your spouse's work history. This means that the vast majority of all Medicare beneficiaries pay nothing for Part A. So if your employer is providing a standard HMO or PPO style health plan, you can enroll in Part A alongside of that. It won't cost you, and it could help to reduce expenses if you have a hospital stay. Medicare Parts B and D, however, have monthly premiums that you must pay. So in a large employer situation, you could delay enrollment into Parts B and D. These parts provide outpatient coverage and drug coverage, which your employer coverage already offers. Later on, when you retire, you'll have a special election period to enroll in Parts B and D with no late penalties. That's a process that we can easily walk you through here at Boomer Benefits when it comes time for you to retire. On the other hand, if the employer has less than 20 employees, then Medicare will be primary and the employer coverage will be secondary. In that scenario, you need to enroll in both Parts A and B. Skipping Part B would mean failing to enroll in what will be your primary coverage. And this will likely result in you covering 80% of your own outpatient expenses, including expensive things like outpatient surgery. So if you work for a small employer, sign up for Medicare Part A and B when you turn 65. You can delay Part D until you retire as long as your employer coverage includes creditable drug coverage, which most do. It's important for me to mention here that there is another scenario where Medicare is primary, and that's when you have enrolled in COBRA coverage from a former employer. COBRA is also secondary to Medicare, so it's very important for you to sign up for Part A and B in that scenario. In my introduction, I mentioned that there was one situation in which you would not want to enroll in any part of Medicare while you're still working for a large employer, and that is if your employer coverage is a high deductible health plan with a compatible health savings account. The IRS will not allow you to contribute to a health savings account if you have any other form of insurance besides the high deductible health plan in place. Medicare Part A is considered health insurance, so in this case, you would delay all the parts of Medicare A, B, and D until you retire. You should also be aware that when you start taking Social Security income benefits, your enrollment into Part A will happen automatically. The two are linked. So this means if you want to continue contributing to an HSA, you cannot enroll in Social Security income benefits either. What you can do with your health savings account, if you have one, is spend the funds that you've accumulated in the past for medical expenses that you have under Medicare now. You can use those funds for Medicare deductibles, copays, coinsurance, and premiums, as well as expenses related to dental, vision, and hearing. Lastly, I want to let you know about one thing we see happen so often. Sometimes your employer forgets to notify Medicare when you retire. If you were working for a large employer with over 20 employees and Medicare was paying secondary, Medicare will still think it's paying secondary. So you go to the doctor or hospital, use your Medicare card, and all your bills get rejected by Medicare. Most Medicare beneficiaries would have no idea how to fix a billing nightmare like this. Fortunately, if you enrolled in your Medigap policies through Boomer Benefits, you'll have free access to our client service team, and all you have to do is call us and we will conference in Medicare to fix it. We will also contact all of your providers with instructions on how to rebill Medicare so that those bills won't fall on your shoulders. And remember, working with us is absolutely free. If you still have questions, I have dropped a link in the notes below to receive our Do I Need Part B checklist. Once you are ready to end that employer insurance, watch our video on enrolling in Medicare after 65, and it will be linked here as well. See you in the next video.